Well, hello and welcome back to Med Monday, where I cover one medication in 5 minutes or less. Be sure to stay until the end when you get to the challenge question and leave your answer in the comments to win a $25 Amazon gift card. So let's get started. So today our medication is Ondansteron. That is the generic name. The trade name is Zofran. It's an antiemetic. It can be given PO, IV push, or through an IV infusion. The mechanism of action is it blocks the serotonin peripherally, centrally, and in the small intestine. So it will prevent nausea and vomiting. We do give this for prevention of nausea, vomiting. And the unlabeled use is for ETOH, usually withdrawals from alcohol and severe vomiting in pregnancy. Contraindication, or why we won't give this medication, includes hypersensitivity, and that means any type of allergic reaction or adverse reaction. Torsades, phenylketonuria hypersensitivity, and prolonged QT segment. That's very important to remember. Side effects include the usual fatigue, dizziness, headache, diarrhea, constipation, abdominal pain, dry mouth, and bronchospasm, which is rare. Our adverse reactions, and again, these would be life-threatening, would include prolonged QT segment, and that is pretty much the main adverse reaction. And that has to do with the EKG. We would be monitoring our patients with cardiovascular disease or history of prolonged QT segment because we want to make sure that they don't go into a lethal arrhythmia. Our nursing considerations include assessing for efficacy. So is this working? We're going to assess for hypersensitivity. So any side effects or adverse reactions, we want to make sure that we assess our patients. We also want to monitor EKG in those with cardiovascular disease for QT prolongation that I had spoken about previously. And we want to monitor for serotonin syndrome. Patient teaching includes reminding our patients to take this medication as prescribed. We want our patients to report diarrhea, constipation, any rashes, or changes in respiration to their physician or primary care provider. We also want to teach them the signs and symptoms of hypersensitivity, and this would be with all medications that we're giving to our patients. We also want to teach signs and symptoms of the serotonin syndrome, and it is okay for an analgesic to be taken if the patient is experiencing headaches. So our challenge question today is: your post-operative patient is experiencing nausea as she wakes up from surgery. The physician has ordered ondansetron at 8 milligrams IV push once. The Pyxis has 40 milligrams per 20 ml vials available. How many mLs will you administer? So go ahead and leave your answer in the comments to be entered in a drawing to win a $25 Amazon gift card. And our winner will be announced next Monday when we drop our next Med Monday. And I hope you have a great week. And thank you for joining me.